Hi everyone. Today my topic of discussion is the clavicle. The clavicle is also known as the collarbone. It is situated at the junction of the neck and the thorax, and one can see in the X-ray picture, you see this is the clavicle, the shadow of the clavicle, bony shadow. Now this clavicle, or you see, it has got a rounded medial end which is known as the sternal end of the clavicle. This is the manubrium sterni, and this is the sternal end of the clavicle. You can feel the sternal end. Next, there is another end which is flattened, and this end actually fits with a process that is known as the acromion process of the scapula. So here it fits and forms the acromioclavicular joint. Now this clavicle, it helps us to make, actually it takes the body arm away from the trunk, and that's why the movement is more facilitated in case of human being. Now this clavicle has got medial 2/3 portion which is convex anteriorly, and lateral 1/3 portion which is concave anteriorly. The junction between medial 2/3 and the lateral 1/3, there is a bend, and this bend is very prone to fracture when a person fall on the outstretched hand from the bike or from the cycle or any other portion. Now you see that medial end of the clavicle, it has got 4 surfaces, and this is the anterior surface, this is the posterior surface, this is the superior surface, and this one is the inferior surface. One can notice in the inferior surface there is a groove, and this is for a ligament which is known as the costoclavicular ligament. Next, this medial 2/3 of the clavicle, it gives attachment to the 2 important muscle. One is in the superior surface, and this muscle is known as the sternocleidomastoid. You see, I pull my head towards this one, and this muscle, you will see, this is the sternocleidomastoid muscle. So this muscle is attached on the superior surface of the medial 2/3 of the clavicle towards the sternal end. So this is the attachment. Now in the anterior surface there is the attachment of a very important large muscle, and that is known as the pectoralis major. So I make the attachment of the pectoralis major. You see, this is the muscle of the chest. I will show you the pectoralis major muscle. So it is situated actually here. The whole of these ribs are covered by the pectoralis major muscle, and between this deltoid muscle and the pectoralis muscle there is a groove. So this is the attachment of the anterior surface of the clavicle. Next come to the lateral 1/3 of the clavicle. Now this lateral 1/3 of the clavicle, you see, in the anterior part, which is the concave, there is a tubercle, and the superior surface is smooth, but in the inferior surface you will see there is a ridge, and this ridge is known as the trapezoid ridge. This is the trapezoid ridge, and this is the tubercle which is known as the conoid tubercle. Why it is got importance? Because you see there is the attachment of the coracoclavicular ligament, by which you can carry the weight of the bag or anything. Now this lateral 1/3 of the clavicle, on the superior surface behind, it gives attachment to a muscle which is known as the trapezius muscle. You see, this is the trapezius muscle. This is the trapezius muscle. And in front there is the attachment of another muscle which is known as the origin of the muscle, that is known as the deltoid. You see, this is the deltoid. It is a fusiform shaped muscle. In my body, this is the deltoid. If you abduct your arm, you can feel the hard muscle one. So you will see one should give the intramuscular injection here below the acromioclavicular joint, that is about 4 centimeter below the acromioclavicular joint. So I think you will like this short video.